let me get rid of this thing. Okay, so today's objectives are to clarify 3 meaningful use requirements for clinical data exchange and information sharing from the RPMS EHR. I want to demonstrate workflow ideas for clinical information sharing in the medical record, or from the medical record, and I want to begin some dialogue regarding implementation of the MU data exchange policies at your program. Unfortunately, these MU requirements are not quite plug and play. You really have to work them into your clinic flow. Next slide. I also want to get feedback on data exchange and patient information sharing in the real world. I want to find out what you guys are experiencing with your C32 buttons, your patient wellness handouts, and how it's going in your clinics, or what are your plans, and get a discussion going that we can make this work in our clinics. I want to discuss, I want to find out what support you guys need. For instance, maybe you need the patient wellness handout button and configuration, or the C32 button and configuration. Maybe you need to know more about 7-zip, semantic encryption, or WinHasher. Please let me know on this call what you guys need. Just feel free to speak up. And I will demonstrate encryption and hashing. Next slide. So the 3 MU requirements that we'll be discussing today is the electronic copy of health information. And I had originally intended to show you a manual that I have that I'm sending out to everybody that has all these items, as well as the rest of the MU measures. But due to our technical difficulties here, I won't be able to show you that, but I will be sending it out after the class. And let me just find, so the name of that manual that I'll be sending is called EPMU Performance Measures Reference Tool, and it will explain each one of these measures in depth. Let's see. Okay, so the first is the electronic copy of a health information. The definition is, for meaningful use, you need greater than 50% of all patients of the eligible provider who request an electronic copy of their healthcare information during the EHR reporting period are provided it within 3 business days. And this supposes that the patient would like an electronic copy to take or have sent to them. Next slide. So this is a kind of a sample workflow, or something that I'd like to discuss with everybody. So that, of course, the patient will request it. Your C32 button will generate a summary of care document. And can I hear from the participants? Has anybody utilized their C32 button, or is anybody having trouble with it?
I've unmuted everyone. Any feedback? Sean?
It works fine. The only issue is when we exit EHR, it comes up with a memory error every time. But other than that, it works.
Okay, so you're just getting a memory error at the end? Okay.
Yeah, well, when we exit EHR, not when we use the button.
Oh, okay. Oh, okay. As far as the button goes, it's good. Anybody else utilizing it?
Southern Indian Health is using it, and we're doing fine.
I'm sorry, and who is that?
Southern Indian Health Count.
Okay. Oh, yeah, that's Sean. Okay.
But if it's a muscle or ligament, then...
All right. Let's move ahead then. Your C32 button has the capability of, gives you the capability of saving it as a PDF, and it can be saved to a disk, a thumb drive, an email. You can turn it into an email. In all cases, your documents must be encrypted, okay? That's important to note. We'll talk about hashing later, and that's not so important. But this this is an important note to remember too. In the event the patient is not in the midst of an office visit, they will need to fill out a release of information form. However, if they are in the midst of an office visit, no release of information will be required. Any questions on that?
People would raise their hands.
This was something that we kind of went back and forth on for a while.
Carrie Glancy has a question.
Okay.
You are unmuted, yeah. Carrie, we can't hear you. You can also type in your question and we will share that with the group.
Tim has a question.
Okay.
So Steve, if you know you're going to do the C32 ahead of time regarding this release of information, is that something the clinics can gather ahead of time through patient reg or through their workflow rather than have to get this up and going by the time the C32 functionality or process needs to occur for example, the summary of care document?
I'm not quite sure what you're getting at here. Can you repeat the question?
I'm sorry, Steve. I'm trying to figure out for clinics, is this something they should do ahead of time regarding the summary of care document, like when they're getting referred outside the clinic for care, to get this out of the way so this doesn't get held up on the back end if the clinic is trying to generate this, that they need this release of information form?
Yes, generally this patient request would come in like any patient request. But this is probably the main scenario. So this would be done, you know, in the background, not during a patient visit. Does that answer your question?
Thank you.
All right. Sorry. Yeah, this is
Steve,
the first.
there is one more question.
Oh, okay.
Carrie was asking, how do we pull out protected information from the summary of care document?
Okay, that you have to configure your patient wellness handout, and you know, first of all, I'd like to find out are you experiencing seeing protected information in your patient wellness handout, and can you describe it to me? I want to get right down to nuts and bolts here.
And you know, can you explain a little bit more about what the actual C32 button means for people who may not be as familiar with it?
Okay, yeah, the C32 button really allows you to pull up a care summary and generate it electronically. So that's one button that's on your GUI interface. Then you have another button called Patient Wellness Handout that I'll talk about in a minute. And that one generates a health summary that you can print out. You can't save it electronically, at least not from the button. And the C32 is more for sending a summary of care to another provider, where the patient wellness handout is for sending that with the patient themselves the day of their visit. So, Carrie, do you have a specific event where you saw protected information coming from the patient wellness handout?
I'm waiting to see what she typed.
Okay. Well, and you can email me with the information as well.
Okay. You want to go on to the next slide?
We'll go on to the next slide. Okay, when you send this information out, you're going to find that you need to encrypt it, and you're going to create a password at that point. So here's another point where the clinic needs to make some determinations. How are you going to create passwords? It's going to be determined by the clinic. It's going to be determined by the patient. This is going to be important to discuss how it works in your clinic. You know, eventually we'll have patient portals where they go in and get their own patient information and a password will be created at that point in time. But right now, this is kind of the clunky version of sharing patient information. So it's another important step that needs to be reviewed by your team. Okay, the last step and it's a very important step, if you back up one slide, is to input the event into the RPMS Release of Information Disclosure system. And this is a very important step because it will give you the credit on your MU reports that you need to say that you actually did distribute information electronically. So you're going to have to decide who and when this is going to happen as well when sending out patient information. And, well, lastly, you're going to have to review meaningful use performance reports in RPMS and or iCare to make sure that this process is being captured and counted. So those are really all the steps for electronic copy of a health information workflow. Is there any other questions? Okay. Next slide. Okay, when do we hash? I know people may or may not be familiar with hashing a document, but this really comes into play when you want to make sure the document that you send from point A to point B is not tampered with. And what you do is use a program called WinHasher on this document that will actually create a hash value on point A at point A. And then when you send it to point B, they will get the information and maybe in a subsequent email they'll get the hash number as well as the password to open it up, the encrypted document up. And this would be for work-related labs like drug tests or other tests that would affect the patient's employment status. It's not a requirement of meaningful use to be using this every single time. In fact, there's probably rare instances where you'll use it. Although some clinics may find it a tool that they really want to use for whatever reason. If they have sensitive patient information, or you know, you need to use it. I'm curious if anybody would see a use for hashing a document at your clinic. And you can type in the chat box if you have any, if you would think of a use for it. Like I could see maybe in behavioral health you could be used, or but I couldn't really think of a time when you would want to hash a document, because of course you need the cooperation of the person on the other side to unhash the document to see if it's not been tampered with. Okay. But it's confusing when you read the manual, because you think, oh, I got to hash all these documents, and that's not true. 99% of the time, only encryption will be needed. Having said that, as you meet with your EHIM and EHR teams, be sure to consider the possibility of existing or potential situations where document hashing will be needed. So you should consider it, and it may be something that you want to do. Next slide. Lastly, you've got to think about media. How are you going to supply this information to your patients? Through disks, thumb drives, email? Email seems the most reasonable, although not all your patients will have email. And you should really think about security. How would you allow foreign thumb drives, disks in clinic computers securely? I just don't think that's possible. And also, you may have outside providers that you work with on a regular basis, and you would want to share information in this way, and you could work up policies around how you're going to send information to the folks that you refer to on a regular basis.
Steve, there is a question.
Okay.
It actually relates back just to the last slide, but it could connect to this. Would CW...
Yeah, I see. Wouldn't password protection be sufficient as long as it has the proper level of encryption? And that's true. And that's what I'm saying. Password protection is plenty. Hashing is just when you want to decide, you want to make sure that a document has not been tampered with. and that's only in special sensitive cases. So typically, you're just going to be encrypting and sending.
Thank you.
Okay, next slide. Then the only other thing to think about is patient education regarding handling of personal medical information. And there should be a handout developed, or I would recommend a handout developed giving patients their rights and responsibilities, because now they're handling their own medical information. The handout could also include the encryption password that you hand to the patient. You can also consider emailing the password. But I would recommend some kind of education process for your community and your patients. Any questions on that?
There is one comment, and I'm going to post.
Okay. There it is. It says, can you create a Visio diagram for electronic copy of health information workflow? RecMU staff can then distribute the PDF version of the diagram to staff ICU facilities during the MU fieldwork. Thanks. Yes, we could definitely create a Visio of a typical workflow that you could then pull from. It didn't lend itself to a PowerPoint, so I didn't put in a Visio. I don't know if you all know what I'm talking about, but it's kind of like a workflow that starts with a circle, then it goes into a... Marilyn, could you explain it better than I can, if you're there?
Hi, Steve. I am here. Can you hear me?
Yes.
Okay. A Visio diagram is just a visual way of illustrating how flow works, and it uses standard shapes like you would for a regular workflow diagram, but in this case the Visio is just being developed in special Microsoft Office software that facilitates the drawing of the diagrams so you can save them electronically more easily. Does that give you what you're looking for?
Hey, thanks. Yeah, and we can work up a diagram and send it out also. We've been doing this with reminders, so we can do the same with workflows for patient information sharing. Next slide. Okay, the other, the second MU requirement related to data sharing is clinical summaries provided to the patients for greater than 50% of all office visits within 3 business days. Next slide. At the end of each visit, a patient wellness handout is generated, and I'm saying that, that's what I'm recommending. I'm curious what sites are going to do about it, but it would seem to me the easiest thing to do is generate one after every visit instead of trying to pick and choose who you're going to generate them for. If anybody has any other suggestions, please let me know. But in order to do that, you're going to have to review your available patient wellness handouts and choose one and modify it to your needs. And one of the things that you have to be careful of is that you're not sending out any sensitive patient information, as was suggested earlier.
So Steve, this is Rosario. From what it sounds like, it doesn't have to be a handout that is all-inclusive of everything on your medical record. It could be just a summary of certain information.
Yes, it'd be a summary of certain information, and it would be really a visit summary for that day. But it would have other information like your medications. It's a good time to do your medication reconciliation at the end of the visit, although you typically want to do your medication reconciliation at the beginning of the visit. So these are all things to think about. You know, they put out the patient wellness handout with a medication reconciliation version. So one thing to think about is to pull up the patient wellness handout at the beginning of the visit, go over the medications, but don't print it out. Just that'll be used for the doctor. And then at the end of the visit, pull up your patient wellness handout and print it out. And at that point, you can hand it to the patient. Next slide.
Sorry, I think Marilyn had a question.
Oh, question?
And actually, you covered the point that I was going to cover, Steve, as well. doing that review at the beginning. Some have talked about printing it out at the beginning and printing it at the end, which I hate to see that much paper generated. But if they would follow a process like you suggested, reviewing everything with the patient and then giving the patient the printed document at the end, that's a great solution. For those patients who might not choose to hold on to them, there should be some method of secure disposal easily accessible to patients, perhaps in the registration or lobby area, a locked bin where they could drop those documents in if they didn't wish to retain them.
Yeah, good idea. Yeah. Any other questions about this? Okay. And lastly, once again, you need to input the event into the RPMS Release of Information Disclosure System, which is very clunky. I would imagine that they're going to automate this at some point. That means somebody has to really go into the roll and scroll and find the Release of Information Disclosure System and put it in. So having a workflow around that, who's going to be responsible for that? It will be, would probably be like front office staff or medical records staff. You just kind of have to decide how it works in your clinic. And then finally, review the Meaningful Use Report in RPMS or iCare to make sure this process is being captured and counted. So you count through the Meaningful Use requirement. Next slide. Okay, and then the last MU requirement that we'll talk about is the electronic exchange of clinical information. And this is really just a test that needs to be done during your 90-day period. And it's performed, and the definition is to perform at least one test of certified EHR technology's capacity to electronically exchange key clinical information. And the process for testing C32 MU requirements is a handout that I'll also be sending you after this meeting. So it gives you the process. If anybody needs any help testing this, figuring out how to do it, please give me a call and we'll get it tested. And you want to do that during your 90-day period. Any questions about that? There's really not much to describe here.
Steve Thibodeau has a question.
Yes, Steve. I don't see it yet. Is it going to come up on the? Probably.
Oh, I think he raised his hand. I don't know if he still has a question. Okay.
Okay, next slide.
Yes,
oh, there he is.
It says you've answered it. Thank you.
Oh. Okay. Next slide. So we talked about the three requirements: electronic copy of health information. And that's very different from patient summaries because patient summaries are printed out at the time of the visit, which is very different from the electronic exchange of clinical information, which will be done just as a test this year. And when you read the instructions, you'll see that you'll be sending a medical information to a repository at IHS or some other institution of your choice. Any questions about these three? Okay. I'm hoping I can share my desktop again. I wanted to go over, well, you can move to the next slide, first of all. Because I forget, these are the reference tools that you'll be getting from me after the call. It's the EPMU Performance Measure Reference Tools, the RPMS EHR MU Configuration Guide, the third-party software for MU compliancy, hashing, and encryption, and the Patient Wellness Handout Description and Logic, the ROI Disclosure System. I think those will be good to have in your library for patient information sharing. And of course, like everything, they're everywhere, so I tried to kind of compile all these for you guys so that you'd have them all in one spot. And
Okay.
next,
when you're ready, I will go ahead and transfer you control.
okay, go to the next slide. Yeah, now I want to talk about encryption and hashing. I won't go over the ROI input because I didn't get a good way of doing it yet. So what we'll do is we're going to record this, and we will add this to the end of the recording because it requires going into RPMS, and there was a couple of things that I didn't iron out before the meeting. I'd like to have a nice smooth demonstration of that. So you can hand me the ball or whatever we call it in GoToMeeting. Here we go, show my screen. And let's see here. So for encryption, the way I'm going to demonstrate this, because I was having connectivity problems to the database today. I'm just going to go to a document, and we're going to pretend that I've downloaded this document from the C32 button. The first thing I want to do is encrypt it. So this is the document. And here's where it's located. So you really should have a place that it's located on your computer. So where I've located most of mine today, most of my documents, get all my windows closed here, is in My Secure Documents Sent. See if I have any sample ones in there. So I've downloaded it, I put it in a file that I know where it's at, and I have my demo female. I have to do one that I haven't done yet. So let me go back here. Go here. Okay, this is one I've downloaded. Hopefully it doesn't have any. There we go. Okay, so that's it. So I want to encrypt it. So if I've downloaded the WinZip program, it shows up on my screen when I right-click on a document. I can convert this to a PDF. That's probably the safest thing to do, so we'll do that first. And it's going to save to My Secure Documents Sent. And there it is. My objectives document is now a PDF. I'm going to right-click it again. I have 7-zip installed in my computer, so I can go to Add to Archive. And I'm going to enter my password. And I have it so you can see the password, but you can also have it so the password cannot be seen. And I'm just going to put zip1 period, and that's the password to get into that document now. And now you'll see that it's been changed into like a compression file, it looks like right there, objectives. And that's my encrypted file. If I want to hash it, I'll open my WinHasher, which is free download from the internet. And then I'm going to browse to it from, sorry, I got too many windows open here. Let me just close this one. There we go. I'm going to browse to it. It's in My Secure Documents Received. Oh no, not received. I need to go to My Secure Documents Sent. Here. And I'm going to choose that one. I'm going to compute the hash. I'm going to copy that hash just with the Control-C function and close it. So it's been encrypted and it's been hashed. Now I want to send this to a patient or a provider. I'll do my new email, and I'll send it to myself. It's patient info. I'm going to attach the file. My document sent. And there it is. I'm going to paste in the hash, supposing that that's what we need, and the password. And actually you would do this on a separate email, but I just want to get this done, so let's just. So normally what you would do is send this and then send the email and the, well, let's do it that way. I'm sorry, let's do it that way. So let's just get rid of that for the moment. Let's send, and then I'm going to send another email. Patient info, the hash, and the password. Okay, now I received my email from whomever. I want to open up this package. It's going to want my password. And that's typically all you would do. But if you have to hash it, I'm going to go ahead and take this and save as Secure Documents Received. I'm going to now go to my WinHasher program if I can see it. Get out of the way there. Going to browse to my Secure Documents Received. Compute the hash and see if it matches with the hash number that I got. And it says that the hash matches. So that's what you do. Couldn't be a bigger pain, but this is what it takes, and this is what we really need to be thinking about, how we're going to be doing this process at our clinics. That's kind of the whole thing. Any questions about that? I don't know. My immediate reaction is it seems like an awful lot of work and very clunky. So I'm hoping they will automate this thing. But I think it's only fair that we know how this works and try to really start working on our workflows and make it work for your clinics, because the payoff is pretty good for the reimbursements that we get.
Steve, I have a question. This is Rosario.
Mm-hmm.
How frequently do people anticipate having to encrypt and hash something like this? Is it really like when they're transmitting information between providers in different clinic practices?
Right, and hashing is only, like I said, only for sensitive information. Mostly all you're going to be doing is encrypting and then sending in a separate email the password. So it's a lot more simple. I just wanted to show everything though on the because this will be recorded, so you'll be able to see that. And maybe we'll even clean it up. We'll use the EHR to do it in. I didn't have access to that today. So in the recording, when it comes out, we'll have it'll come straight from the EHR, and we'll show you how to do that. But typically, you're going to be downloading a document like the C32, and then encrypting it, sending in a separate email the password, and that's how they'll get it. And that may be to a patient or to another clinic. So it brings up a lot of questions. I think it brings up more questions than answers, but I really felt like you needed to know what the workflow would look like.
There is one question.
Okay.
It's in your chat. Will the patient wellness handout portal reduce the workload if and when it is developed and deployed?
I would think that it would, but I have no idea when that's going to happen. I don't even have a clue. If anybody's heard anything, you know. But I think for now, if you think of it, number one, the patient, at least for the number one MU requirement, the patient has to request it. So there probably won't be a lot of requests at first. But for the patient wellness handout, that's going to be something that you got to figure out every day how to do. But remember, for the patient wellness handout, it's during a visit and it's just a printout. So there is no hashing or encryption involved in that process. And that's the one that's really going to affect you the most. Any questions about that?
There's another question.
Okay.
Actually a comment. And, this is from Marilyn Freeman. I believe that deployment of the patient health record is scheduled for later this year.
Is that, you mean for the portal? Or is it?
Let me unmute her. Marilyn, you're unmuted.
I needed to unmute myself as well.
Mm-hmm.
That would be the portal that patients can access. I believe that that deployment is scheduled for later this year, and it will involve some work at the clinic level to register patients for the portal, and then they'll be able to access their own information online. So I don't know if that's what the question was directly related to. It is a little different functionality than the patient wellness handout, which is intended to be a communication device between the patient and the provider. What it might mean when the personal health record is available to patients and they begin to use it, what it might mean is that you may not be printing that patient wellness handout at the end. You might choose to print it earlier in the visit and choose to have more of a discussion with them at that time.
Yeah, well, and I could also see if they actually have a password to get into their patient health record, they could use that same password to encrypt their information that they walk away with the clinic from. So that would be nice, because right now I still don't know. I don't know if anybody's worked on that problem. What kind of passwords are you going to hand out to people? Are you just going to have them make their own password?
What some healthcare facilities are doing, and I know this because of my work with Vista Imaging, I'm not sure that I'm real happy or excited about the way that they're using passwords, but the passwords that are being used are simply the patient's date of birth. And we could have a whole discussion about that.
Yeah, mum's the word then. No, but I wouldn't recommend that. But
I agree. I'm going to mute myself so you don't hear me talk.
Okay. So anyway, I will get you all the resource material, and I'd love to hear from you guys when you want to work on your workflows. We'll send out a sample workflow on a Visio diagram. We can definitely be in the room and help you kind of figure these things out. And that's really the end of my presentation. Thank you.
Are there any other questions from the audience? Okay. Well, with that, this concludes our webinar for today. As Steve said, he will be forwarding you additional attachments and documents related to this presentation. This presentation will also be available at crib.org/REC within the coming days as a recorded file that you can then watch. So with that, thank you all very much. Thank you, Steve, for taking the time to walk us through this. And if you have any questions, feel free to email them to me at rec@crib.net. Otherwise, we will see you next time. Thank you all.